The purpose of this video is to explain the VentFirst randomized clinical trial. You will also be given a written informed consent form about the study. After reading the consent form and watching this video, you will have time to ask questions about the study. Then, if you would like to participate, you may sign the consent form. The purpose of the VentFirst study is to determine whether helping extremely premature babies breathe before cutting the umbilical cord decreases the risk of bleeding in the brain and other complications of prematurity. The study is taking place at multiple hospitals in the United States and Canada. When babies are born premature, the standard recommendation is to delay cutting the umbilical cord until at least 30 seconds after birth, or 60 seconds if the baby is breathing well. The neonatology team provides assistance with breathing after the cord is cut and the baby has been moved to the stabilization area. This is what will be done for babies in the standard group in the VentFirst study. The following video is a simulation using a doll to give you an idea of what happens during a standard delivery.
All right, push hard, push, push, push. Okay, there's the head. And there's the body. Time of birth?
12:09. All right, stimulate the baby to breathe and suction if needed.
After the baby is born, the obstetrician will stimulate the baby and try to get them to breathe.
Is the baby breathing well?
Baby's crying.
I agree, the baby looks to be breathing well. Continue stimulation.
Looks like he's not breathing anymore.
I agree, looks like he's not. So let's clamp the cord now. We're at 45 seconds.
In the VentFirst study, half of the babies will get this standard treatment at birth, and the other half will be assigned to a new way of assisting breathing before cutting the umbilical cord. There is some evidence from other studies that helping the newborn breathe before cutting the cord results in a more stable transition with less changes in heart rate and blood pressure. The purpose of the VentFirst study is to determine whether helping extremely premature babies breathe before cutting the cord at 120 seconds leads to a lower risk of bleeding in the brain or other complications of prematurity. The only way to know whether this is beneficial is to do a large randomized study. The following video is a simulation using a doll to give you an idea of what happens during a VentFirst delivery.
All right, the head's out. One more push. Okay, time of birth.
12:34.
After the baby is born, but before the umbilical cord is cut, the neonatologist will suction the nose and mouth, put a hat on the baby for warmth, and stimulate the baby to breathe.
"20 seconds. Is the baby breathing well?"
Baby appears to be breathing well. Take a couple cries.
30 seconds. You can go ahead and start some CPAP.
While the baby is attached to the umbilical cord, the neonatologist will assist breathing. The baby will have its heart rate checked periodically to ensure that the baby continues to do well. At 120 seconds, the obstetrician will cut the cord and the baby will continue to be cared for by the neonatology team.
"10 seconds until the cord clamp. Prepare to clamp. Clamp cord."
As soon as the baby arrives at the warming table, the study procedures are complete. Babies from both groups will be treated as if they had not been enrolled in the study. We will continue to collect information on their course and the remainder of their hospitalization for purposes of study analysis. If you agree to participate in the VentFirst study, and if you deliver between 23 and 29 weeks gestation, you will be randomized, or randomly assigned, to either the standard group, which is 30 to 60 seconds of delayed cord clamping with breathing assistance after the cord is clamped, or the VentFirst group, which is 120 seconds of delayed cord clamping with breathing assistance given from 30 to 120 seconds. You will not be able to choose which group your baby is in. If you have a C-section and are randomized to the VentFirst group, members of the neonatology team will be sterilely prepped like the OB team and will provide breathing assistance before cord clamping. With any research study, you need to know the potential benefits and potential risks of being in the study. If your baby is randomized to the VentFirst intervention, the potential benefit is a lower risk of bleeding in the brain or other complications of prematurity. The potential risks to your baby are a higher red blood cell count and a higher bilirubin level or jaundice because of getting more blood from the placenta. In addition, if you have a C-section and are randomized to the VentFirst intervention, there will be additional personnel and equipment at the surgical field. There is a small chance that this could increase your risk of developing a postoperative infection, and you may also have a slightly increased risk of bleeding complications during the procedure. It is important to note that babies in both groups will receive the same type of breathing support according to the standards of care for all extremely premature babies. There are three main differences between the groups. First, timing of umbilical cord clamping. Those in the standard group remain attached to the cord for 30 to 60 seconds, while those in the VentFirst group will remain attached for 2 minutes. Second is timing of when breathing assistance is started. In the standard group, babies will receive breathing assistance after the cord is clamped and cut, while those in the VentFirst group will receive breathing assistance before the cord is clamped and cut. And third, where breathing assistance is started. Those in the standard group will have breathing assistance started at the warming table, while those in the VentFirst group will have breathing assistance started in the delivery area. Thank you for watching this video, and we encourage you to read the VentFirst consent form and ask any questions as you decide whether to participate in this research study.